Okay, so here we have a nice, pretty dark-skinned patient who comes in for hair removal. Very common problem. Sometimes young ladies just have some hairs that they don't like in their chin and under their chin and upper neck area. So we do hair removal with lasers. The darker the skin, the more careful we have to be in order to protect the skin while properly eliminating the unwanted hairs. So how many treatments does it take? It depends. The darker the skin and the finer the hair, the more treatments. The lighter the skin, the coarser and thicker the hair, the less number of treatments. So we have to use a special wavelength for dark skin. We can't just use any laser. We have to be very careful. We have to use cooling to protect the skin. So this is air cooling. We're cooling our skin with it now, and ours comes out of the same pore that the laser beam comes that you can see over here. So we do test spots. We make sure the patient doesn't have any irritants on their skin. They're not on medicines. If they are, it doesn't make them more sensitive to light, because the laser is just using light to create heat to selectively destroy the unwanted hair follicles. So now we'll turn the laser on. Okay, so after we've done all our precautions, most importantly, we provide eye protection for the patient and the operator. You can see the spot of the laser. How's that? Okay, so again, we do a test spot even though we've done it just to make sure the settings are fine. Stretch the skin really well. So we can see the hair follicles getting destroyed by absorbing the light. As you can see here, the darker the skin, you can get ingrown hair known as pseudofolliculitis, and then they can leave tiny little darker stains on the skin. So with removing the hair through laser hair removal, we eliminate that problem also. Be careful of the bottom. I think I can tell she can feel it more on the chin than under the chin on the neck, because the hairs are coarser and thicker. So because they're coarser and thicker, they absorb more light, therefore you can feel them a little bit more. But how would you rate the pain on this?
On the chin, the pain was like 6.
But does it feel like pinpricks or rubber bands?
Yeah, rubber bands now.
That's what most patients say. Yeah. So you can clearly see the areas that we've done before. There's almost no or very few residual fine thin hairs, but there's still more thicker hairs around the chin area. So every patient's different, every area is different, and even the same patient during different times, depending on if they're on any medications or illness or any other change could require different settings. So it looks easy, but it's very important to individually evaluate each patient, each treatment, in order to optimize their treatments.